So, global health officials are warning hantavirus cases will continue to rise. Only 3 people have died from the outbreak, but the number of reported cases is now up to 11. The World Health Organization has confirmed 9 of those. So, joining us live now to talk more about this outbreak is Dr. Abrar Karan. He is with the Division of Infectious Diseases at Stanford University. Doctor, thank you so much for joining us. You know, there are concerns that the number of confirmed cases continue to rise despite the virus not being airborne. Your thoughts?
Yeah, so I think we expect that the cases are going to continue rising. And part of the reason is that we're still in the incubation period from those initial people that were exposed on the ship. Remember, it can take 3 weeks or even longer in some cases before you start to show symptoms and that you're infected. So I think it is expected that we could see some more cases here, and that should not be a surprise on its own. What would be surprising is if it were people that were not on the ship that ended up testing positive, and that's something that we haven't quite yet seen, although I know there are some people under investigation in that scenario when you look globally.
What are the early warning signs that public health experts watch for that would indicate an outbreak is becoming more serious?
So the biggest sign would actually be if you started to have cases that were not linked to any, because then you basically have runaway transmission chains. We don't have that yet. I don't expect that to happen. Although, as you remember, there were some people that had left the boat earlier, particularly the second case that had gotten onto a plane and traveled. You might imagine that that person could have come into contact with people in the airport, in line somewhere in a bathroom, and if those people then went off and were never identified as contacts and tested positive, that could be a very tricky situation. But a runaway epidemic or outbreak is really where you can't trace cases properly back to another case.
So, different countries have different rules about exposed patients returning home. So, is a global framework necessary to mitigate spread? What happens?
Absolutely. I think this is kind of problematic because you're dealing with the same virus, even if it's in different countries, even if it's in different return travelers, and the epidemic risks are similar, right? And so essentially, you have some countries like Spain that are more conservative, and they're basically keeping people in the military hospital for the entire duration of the quarantine. And then you have other systems and places where they essentially are saying a few days of quarantine, and then you can go home and quarantine at home. And I think that opens up risks because expecting perfect quarantine for somebody to do that at home is very difficult. If you look at the WHO's recommendations, it says if you have anyone else at home that is not a passenger, is not exposed, you need to be in a separate room from them. If you're even close to them, you need to be wearing a respirator. I don't think that's feasible for 42 days. So hopefully that is not something that would happen.
So, to be clear, experts have been very clear this outbreak will not become a pandemic. So, moving forward, thinking bigger picture, is the U.S. and the world prepared to handle the next one if it should happen? And if not, what needs to happen?
Yeah, so I mean, in this situation, I think we've gotten lucky that we detected this as an outbreak quickly on the ship. We were able to figure out who was there, who is exposed, who needs to be in quarantine. A future scenario could look very different. If you had someone coming back from this area in Argentina and they essentially didn't have symptoms and got exposed and then were infected, it would take much longer to figure this out, and it would be much trickier to trace potential contacts if the first case came into like a big city, for example. And remember, this situation could still happen. You could still have someone return from the same exact place in Patagonia where this case had gone to, come back to the U.S. and not get diagnosed correctly. So I think this is a canary in the coal mine. It kind of tells us what is possible in a worst case scenario with Andes virus as an epidemic prone pathogen.
Good information, Dr. Cron. Thank you so much.
Thanks for